And the question is whether these kids really have oppositional defiant disorder.
Hi, I'm Dr. Erika Krumbeck. Welcome to NatPeds Pro, where we break down evidence-based research and whole-body approach to pediatric care. This channel is for healthcare providers looking for clear, research-backed insights into treating pediatric patients with confidence. Don't forget to like and subscribe. Let's get started.
It's very, very common in toddlerhood for kids obviously to have some resistance or some what we call like maybe defiance, and they really shouldn't be diagnosed with oppositional defiant disorder. So that's one of the biggest things that I really want to clarify for both parents and providers when we're starting to talk about oppositional defiant disorder, to make sure that the diagnosis is correct on it. Oppositional defiant disorder, there's so much nuance in this topic because children are children and humans are humans, and we all have days where we're grumpy, and we all have days where we say no to others, to people that we love, or to maybe our boss, or to our parent, or to our teachers. And so the question is it a variation, a normal variation in childhood behavior, or is it something that actually reaches criteria for a real disorder? Symptoms of oppositional defiant disorder need to be present on most days for at least 6 months, and there have to be at least 4 out of the list that I'm going to read. So these include often losing temper, often touchy or easily annoyed, often angry or resentful, often argues with authority figures, or for children and adolescents with adults, often actively refusing or defying to comply with requests from authority figures, often deliberately annoying others, often blaming others for their mistakes or misbehavior, and then if the child needs to have been spiteful or vindictive at least twice within the past 6 months. So the question often becomes, again, whether it's a normal change in childhood behavior or whether it's truly oppositional defiant disorder. The majority of kids don't want to be bad. I've yet to meet a kid who enjoys being a bad kid. Children really yearn for that connection, especially with their primary caregiver or primary caregivers. And so it's always a bit of a sad phenomenon when we see a kid in this cycle of misbehavior. They often feel terrible about their misbehavior afterwards. So again, I feel like the diagnosis of ODD, I feel like it's misdiagnosed a lot. And so I would like to spend a reasonable amount of time today talking through what looks like oppositional defiant disorder and has nothing to do with ODD, or actually might even meet the criteria for oppositional defiant disorder, but I think should be treated, the other problem or other condition should be treated before oppositional defiant. Kids being labeled as defiant really puts a burden on that child. So they're automatically kind of labeled a bad kid. And we know how psychologically damaging that is for children. It's incredibly important for kids to have and maintain a connection with their primary caregivers. That is what all research has shown is the most important thing for positive psychological growth in childhood. So when kids are labeled defiant or bad, that automatically breaks that connection with their primary caregiver, and that's going to be really problematic for them moving into adolescence and adulthood. Those are things that I'm really passionate about talking with parents. Again, there's so much nuance in this subject. So kind of going back to the idea that kids don't want to be bad kids, that's automatically a red flag for me that something else is going on. So I would say number one thing to look at for kids that we think have ODD is actually pediatric depression. Pediatric depression does not look like adult depression in almost all cases. Pediatric depression looks like persistent sadness, lack of interest in activities, changes in appetite, sleep, irritability, feelings of worthlessness or guilt, and then of course in severe cases, thoughts of death or suicide. We usually don't see those severe symptoms until kids are adolescents. And I will say, in my opinion, I often don't see children that I strongly suspect have depression really show signs of persistent sadness. What I typically see first is the change in appetite or sleep, withdrawing, maybe not completing homework, not engaging in activities as a family, not wanting to participate in sports or extracurricular activities, And then I do see a lot of these feelings of guilt, feelings of worthlessness, irritability, and that can manifest really closely to what might look like defiance. But really, these kids are just heavily withdrawn. So if you're experiencing a child, say in your practice, in your family, that's withdrawing and is then defiant, I would suggest looking at a diagnosis of depression first. And what's really important for me as a primary care provider and a naturopathic doctor is that depression in children often corresponds with something medical. So that could be something like sleep apnea. Kids are not sleeping well, they're irritable, they're withdrawn, they're defiant, they're depressed. Anemia is probably my number one. Anemia results in a number of things. So we know that iron deficiency is so closely tied to deficiencies in neurotransmitters like serotonin, dopamine, epinephrine, norepinephrine. So these kids could be irritable and withdrawn because they have anemia or they're iron deficient. That's super important. Lead toxicity can result in both defiance and a misdiagnosis of oppositional defiant disorder or pediatric depression. And so that's really important for me too. And then a number of other things. We also talked about thyroid and hypothyroidism, and actually hypo or hyperthyroidism. So high or low thyroid function could result in irritability. It could result in being withdrawn, apathetic, anything like that. So I see that a lot, and I do want to screen kids for pediatric depression first, because when you have a child who is what we consider defiant, and the kid's being labeled a bad child or a defiant child, even if they're not labeled bad, if we put that diagnosis of defiant on them, they're going to feel bad. And then we find out later they're actually depressed. That, to me, that's heartbreaking. It's really sad to see a kid who's defiant because they're depressed, or who's defiant because there's something physically, medically wrong with them and they're labeled a bad kid. It's really crushing to me to see, and I have seen it a number of times in my practice.